Calling to order the Municipality of Monroeville's Citizens Night and Agenda Setting Meeting for April 1st. It is approximately 7 p.m. If you'd all please rise for the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You may be seated. Have a roll call, please.
Mayor Grieslock?
Here.
Mr. Hizzy?
Here.
Mr. Poach?
Here.
Mr. Stevenson?
Here.
Mr. Crut?
Here.
Mr. Adams?
Here.
Mr. Williams?
Here.
Mr. Biondo?
Here.
Mr. Graziani?
Here.
Mr. Ratcher?
Here.
Ms. Rock?
Here.
Mr. Hugus?
Here.
Mr. Sedlak?
Here.
Mr. Weldon?
Here.
Mrs. Lang?
Here.
Welcome. This is our Citizens Night and our agenda setting meeting. This is not a voting meeting for this council. Everything we're considering for this evening, we will be voting on next Tuesday, or choosing to vote next Tuesday. This is not a voting meeting, and we're going to be going through our agenda of what we are going to be considering for next Tuesday. And we're also going to start the meeting with our Citizens Night. This is a time for residents and taxpayers to make comments on any municipal item. We always ask that you keep your comments to a 5-minute time frame. We feel that's enough time for the meeting to move along and for people to get their point across. There will also be another comment period before next Tuesday's meeting for agenda items only, so the items that we'll just be voting on for next Tuesday. At the end of next Tuesday's meeting, there will be another comment period as well for any municipal item. So this would be your opportunity and your only opportunity this evening to present to council, to make comments to council, either on the agenda or for any municipal item, with the exception of the conditional use hearings that we'll be having. You'll have another opportunity if someone wants to put testimony in for those items. But for now, I'm going to open the floor for Citizens Night for remarks and comments. If there's anyone here who'd like to address council on any municipal item, now would be your chance to do so. And if you just pick a side, and then if you haven't already, sign in. You have?
I have, right here.
Thank you so much. If you just state your name for the
My name
record.
is Andy Yalch. I live in University Park.
Welcome, Andy.
Thank you. My family owns Charlie's Ice Cream and that pizza place and all that down on that corner. And all the property.
Speak up, please.
Oh, I said my family owns Charlie's Ice Cream and the whole property on the corner. Hey, yay. That people have been going to Charlie's forever, so I know that. I took my kid there when he was 2. He's 46 now, so all I can say, it's a I don't know. It's a good business, and we have the pizza place and that next door to it. But anyway, having this facility next to very close to where our property is, and any spillover from people that are attending that facility, anyone hanging out down around our property with these kind of problems and the condition they're in, I don't think it's a good idea for the safety of all the children that come there, because there are thousands of children that come there yearly with the baseball teams and everything like that. And having taught inner city public school where these facilities were on the same streets, I taught for 30 years in the Wilkinsburg School District. And having these facilities near the population is not a good thing. I have friends in down by the reservoir, whatever, that Highland Park, and they put, a friend of mine had one just on the corner of his house. My nephew lives on the same street, and while it was there, it was not a good scene. That's all I can say. But I'm just asking you, please vote no on allowing that to happen. That's all. Thank you.
I'll leave the floor open. And I believe Andy was referring to actually one of the conditional use approvals we're going to be discussing later in the meeting for Pyramid Healthcare. And there will be a presentation to council and the public regarding what's being proposed and what we're going to consider for next Tuesday. So stay tuned here over the next, throughout this meeting, we'll learn more about that item. I'll leave the floor open for citizens' comments or remarks. Well, if you're here to speak about item number 2, which is Pyramid Healthcare Incorporated, which is the conditional use approval, we're going to have a different hearing about that. So if you want to talk about that,
Wrong day.
nope, you're here on the right day, just wrong time period. So just
Speak now?
you can speak about any municipal item. However, what I would encourage you, if you're here to talk about for or against that Pyramid Healthcare Incorporated, I would encourage you to wait until we get to that part of the meeting, because then that way you're being sworn in and it's part of the testimony for the conditional use hearing.
I'm gonna sign it anyway,
Sure,
so I'll be ready. I'll wait.
I won't forget, don't worry.
I got testimony like him right here.
Very good. I'll leave the floor open for Citizens Night, this is your public comment period on any municipal item. We will be having those conditional use hearings here very shortly, once we get through the meeting, through the agenda.
Thank you.
I was all relaxed back there because I saw a lot of people signed in before I did here. So my name is Alyssa Beck, and there's a lot of people here that probably don't know. I founded an organization in 2009 called Sustainable Monroeville, and I co-founded Reimagine, the Turtle Creek Watershed and Airshed communities, and we're in the Turtle Creek Watershed. And so is Monroeville Mall, and so are about 33 other communities that will benefit from the redevelopment of the mall, which I'm very excited about, because in our Reimagine process that started in 2019, in 2021 and 2022, we had a high school essay competition. And in that competition, the question that was given to the students was, what would you like to see at Monroeville Mall? What would you like it to become? There is raw footage of that, raw film footage with filmmaker Mark Dixon that I would love for either council or the mayor or the municipal manager to provide to the developer. And I don't even have my notes with me of the mall, which is called Representing Cypress, yeah. And so I'm here to make an appeal to everybody here, including the people behind me, to try to figure out how to get a 5-minute film short created so that we can help the developers who are in the process right now of planning that development. They're right in the middle of it, to make sure that the independent businesses that are there stay there, even if they have to give them a break for the rent, like the juice place, which I happen to love at the mall, and the new coffee place, so that those places stay there, and that the Walmart be in its place, that it not be a superstore, and that we make it clear as citizens that we understand there's going to be a Walmart there, but we don't want it to be the whole place. And that's what I came here today to do, to make an appeal. Can the donations be through the municipality? Can it be, I'm an informal nonprofit. I'm not a 501c3, but I'm just seeding the room. There are 2 5-minute videos that I'm going to supply to the mayor and to council in the next day or two that Reimagine Turtle Creek Watershed and Airshed created, that gives you a synopsis. Everybody here ought to look at it in the next day or two. It's on YouTube. Because this can be a showpiece for the world. And I've been talking about Monroeville being a showpiece community for 20 years. I've been coming up here. And a lot of people haven't even heard of Sustainable Monroeville. I don't care anymore. But this is an opportunity, because we're at the gateway. We are the gateway, and we can be this, because we have a diverse community, and we can rise up through it. So, and I just wanted to present a gift, not only to Eric Poach, my councilman. This is my book.
Did you sign it?
I signed it to you.
Thank you, okay.
So I'm not only presenting it to Eric, but I'm doing something wild tonight, because I got a box of books in my cars, and I'm giving a book to anybody who wants it here.
Thank you, Dr.
Thank you, it's
Okay?
very kind of you.
So thank you very much. Thank you for all
Long as
your
you
efforts.
sign it.
I believe that our efforts brought a good development into our town, and we need to rise to this occasion and show what we can do.
You said, what's it called, what is it on YouTube?
Reimagine
well, it's-
TCWAC.
Did you pull the two videos up? They're 5 minutes each. One of them was,
Alex, Alex will send it.
one of them took place at the Braddock Public Library, which is part of the Turtle Creek Watershed, in 2019. The other one took place at the Forest Hills Municipal Building, the new Regenerative Future facility and that was right before COVID struck. So we're on to something here. I just want everybody to know, I've got goosebumps now. It's very exciting, so thank you.
Thank you, Dr. McHugh.
Thank you, Liz.
Thank you for the book, by the way.
I'll leave the floor open.
You always get a book. I'll read it. No. You always get a book. She becomes really famous.
Wait, while they're fighting, I forgot I have one more gift for Mr. Graziani. This is the book I just read. It's called The Serviceberry. The serviceberry is a tree that's native to southwestern Pennsylvania. It's good for birds, native birds, and it's good for people. And this is an incredible book by an author that some of you know, Robin Wall Kimmerer. Yeah.
Thank you. Thank you.
Because I want to see those trees in the parking lot of Monroeville Mall.
Thank you, Doctor.
Hi, my name's Linda Quinn. I own the property at 194 Orchard Street in Monroeville. I'm asking the borough tonight to continue to maintain the last 179 feet of paved roadway that's in front of my home. The 179 feet of road that I'm talking about was previously maintained by the borough from the time it was constructed up until like 2012 when I built my house, and then through 2018. And then they resurfaced the road in 2018, and they stopped about 179 feet short of the pavement, the finished pavement. They put up a sign that said that Monroeville maintenance will end here. And my concern is that at the end of the paved surface that isn't maintained, there's a fire hydrant right in front of my house. So if there were to be a fire that would, I'm concerned that the fire company may not be able to make it the whole way back down the road. Not to mention the U.S. Postal Service, they occasionally deliver packages to me, and if the road isn't maintained, then they won't be able to get through. In addition to that, I did look it up, and Ordinance 227 was actually signed in September of 2060, when the road was still a dirt road. It was paved in 1972, and the ordinance has never been changed since then. I talked to Alex, I think in October, and he looked into it along with, I think, Jamie Story and Paul, and they suggested that maybe we revise the ordinance from this ordinance 227, revise the footage on it from 2,376 feet up to the 2,713 feet, which would cover all of the pavement in front of my home. So I'm asking the borough tonight to consider that.
Thank you.
Thank you.
I'll leave the floor open.
Orchard Street, not Orchard Avenue.
Good evening, Georgiana Woodhull. I left my briefcase at home. I know I have 5 minutes, but I do
You
want to
can
know.
run home and get it.
Pardon me? I want to know, is there anybody here from Cypress Equities?
No,
Is there anybody here from Walmart?
no.
Okay, well, I guess I want to find out, in this article, this is from the Thursday, February 13th, 2025, article about Walmart purchases Monroeville Mall for $34 million. I read through this, and it's, let me just read a portion of it, just refresh your memory. Arkansas-based Walmart will be working with Dallas-based real estate firm Cypress Equities on the mall operations and potential redevelopment, said Mark Rickle, Director of Corporation Communications for Walmart. Walmart did purchase the Monroeville Mall, is very interested in being a part of the future and any future redevelopment of this site. There is no Walmart in Monroeville. The closest Walmart sites are in North Versailles, Salem, and Hemphill. The Monroeville property is well-suited for a major redevelopment, and all options are on the table," said Chris McGuire, CEO of Cypress Equities. I'm going to skip down, and it says, "We had," and this is McGuire said, "Cypress has been involved in talks about the property since October of 2024. We had a series of meetings with the mayor and his team, and they were incredibly supportive of the idea of the redevelopment of this property." Mayor, who is on your team? I'm not on your team, and I would rather be part of the project than.
I'll let you have your comment period, and I'll answer
Okay, okay.
afterwards. Yeah.
So it says anyway that, as I guess, let me find another section here. I'm not going to read the whole article, but it says that Monroeville Mayor Griesbach said he is optimistic. "In my opinion, mixed use would be ideal residential entertainment, restaurants, and retail," he said. "Our 2023 zoning ordinance update has allowed for those types of development." I just want to make one comment. I was on the Planning Commission in 2015 when it was also part of the updated ordinance that we were working on. I can remember taking a few people up to the Village of Pine in Wexford. I don't know if you've ever been there. It's a beautiful development. Went to St. Barnabas, that whole area. Brought up the Tunnel for Towers. And I know what my vision is, but we're not part of that process right now. And I know, Mr. Poach, you mentioned at the meeting, I wasn't at the last meeting, but I did watch part of it, where there may not be advertising in the papers, that it might just be online. I'm not online.
Yeah, well, it's something that's moving through the state legislature.
Okay, all
Proposal to do
right.
that.
So people like myself who are not online are not going to be able to get that information anymore. Is that correct? We won't know. I
No, not
watched the
necess- not
Thursday and
necessarily.
Sunday.
They'll also use other, the intent was to reduce the burden on individual municipalities, not as much in Monroe, but many of them, it's quite a hardship that the folks have put them through to terms to continue to advertise in.
I don't think
medium,
it's a hardship in Monroeville. I truly don't. Financially think it's a hardship.
It's moving through the state legislature because across it is, and unfortunately, no disrespect, Georgiana, but if you're not, it's
Believe me,
probably
my
in the
phone will be
minority.
ringing off the wall.
Yeah,
I
you know,
mean, I
sure.
I keep
it's not
saying,
like
call your
you know as
councilman,
much-
call your mayor.
Yeah,
you
right.
know.
Call Georgiana, right.
Yeah.
Yeah.
Anyway, so I walk the mall. You know, I've tried to get answers. I've gone in the mall. I'm in the mall every week, 3 times a week, usually. I was there today. Nobody's talking in the mall. Nobody seems to know anything about what's going on in the mall. I looked around, somebody I thought might have been part of Cypress, but, you know, I see the mall cops, me and the mall cops. That's who was at the mall today, basically, when I walked. You know, it's a sad situation, and I honestly, I drive to Ross Park Mall or to South Hills to do my shopping every single week. And I can remember back in the 70s, because I worked 3 jobs, and one was at the mall, and back in the 70s. And I can tell you, because I hear people keep referring to the DoubleTree, Hilton DoubleTree, Radisson. I worked there when it was the Sheraton Inn on the Mall in the 70s. And it was, in my opinion, close to a 5-star hotel. And I'd like to see, we don't have that here in Monroeville. We need to get rid of some of these smaller hotels that are a burden on our police department. And we need to go back to, we have to look for better.
Thank you.
You're welcome.
I'll leave the floor open for public comment.
Gary. Gary.
Hello, everyone. It's been a while. My name is Gary DiLorenzo. I live at 451 Colonial Drive in Ward 3. One of the reasons that I wanted to say a few words is I've been living in Monroeville, Ward 3, since 1987 with my wife, Patrice. 2 children, both graduated from Gateway High School, been a long-time resident of Monroeville. One of the areas that I come from, living in Monroeville, is, without getting into my background on the career side with industry and academia, once I got my doctorate, I come from a background of service to the community. One of those areas tied into how can I help the environment in Monroeville? Some of you know I was on the Monroeville Municipal Authority as a board member for 10 years, and I was actually chair of that organization for 4 years. I was actually also president of the Park Swim Club, where my children swam. So I come from a background of service to the community, and I like to continue that if I can. So why am I here tonight? What is my message? I just want to let this council know, and anybody in the audience that might not know me, I'll be running for council for Ward 3 this year. And I look forward to, God willing, if I have an opportunity, I can work with this organization on the continued services in Monroeville that are exemplary, working on capital improvement opportunities, such as the infrastructure with the mall, and a variety of initiatives that hopefully could materialize for me. So I just wanted to reintroduce myself to everyone, and thank you for your time.
Thanks, Sheriff.
Thank you.
I'll leave the floor open for comments on any municipal item. Seeing none, I'm going to close the Citizens Night comment period.
Shirley?
And just to refer back to what was mentioned, we're talking about an article in the Times Express, they always get all the facts straight, not necessarily, but myself and Mr. Graziani, we met with Cypress Equities 2, maybe 3 times. We met with them when they were interested in the purchasing of the mall, because it was going to go on sale. We did not know, no one in the municipality knew that the mall was going to be for sale. So this company came in and said, hey, this is happening, did you know this? And we are one of the ones that are interested. So we had that meeting, and then once it went through, we had a follow-up meeting about that they did purchase it. However, as far as Walmart, we learned about Walmart just like everybody else did from the news. Walmart was a silent investor with Cypress Equities. So as far as a team that might have been referred to in a Times Express article, as Mr. Graziani and myself, I believe Paul Wielden at one point was met with, as far as zoning officer, met with them. And I believe that was it. So I think what they're referring to as far as a team, that they met with different people, staff members in the municipality. But the quote that they did get right is, yeah, I'm very optimistic about it, and I think what they're proposing is really, is going to be good. We don't have the details of that. Last I heard, that they were in the process of hiring a design firm, and they were interviewing design firms. So there's no designing happening at this point. They're not even at that point yet. Cypress Equities is interviewing and going to be hiring design firms, and they very much stress to us that they are going to involve the community, they're going to involve staff, council, residents, businesses. They're very optimistic, they understand maybe some of the things that was mentioned, and we can all agree that, how important the mall has been for Monroeville for so many years, and for so many years how it has fallen away from that, and they understand how much of a centerpiece that is for our community, and we really look forward to working with them. Walmart being in the mix and in the picture as well. Certainly Walmart has a lot of capital to get things done, and but we are very interested, as everyone else is, in what they propose. But as we learn things along the way, we will be putting that information out to the community, absolutely, because this is something that's very, very important, and this is something that is going to impact this community for decades. It's a big deal in this community. It's a really big deal, and I think that right now we have a very good owner of the mall, and I think long-term it's going to be a great thing for the community. So I'm going to close this, Citizen Night's closed, and we're going to move into our conditional use. We have public hearings this evening. There was one or two speakers that brought this up. That's not this item. We're going to start with 25-1-C, Love and Bright Beginnings. This is a conditional use approval. Mr. Graziani, please.
The applicant, Laurel Land Company, is requesting conditional use approval pursuant to Article 5, Section 504.L Child Care Center principal use of the Monroeville zoning ordinance, number 2779, to permit the operation of a child daycare business. The property is located at 4328 Northern Pike, Suites 101, 105, and 107, and identified as tax parcel 856-7-012 in the Boulevard zoning district. The applicant is here to make a presentation, I believe, this evening. This has gone through Planning Commission, and if you have in your packet, you'll be able to see, and we'll review next week, because the applicant is coming up, the different conditions as spelled out in the draft materials presented by Mr. Wilden via the Planning Commission. Good evening.
Good evening. I'm Laura Bartolomici James. I'm the owner of Laura Land Company. I own 4328 Northern Pike. And as you guys all know, office space is plentiful in Monroeville. And I unfortunately have a building that's 90% vacant.
And then Laura, hold that thought for 1 second. So I just want, yep, you're good. And then this is a conditional use hearing. We're going to open it for a hearing. Is there anyone here that wants to add testimony for this item at this point? If anyone's here to speak for or against this item?
Raise your hand and be sworn in.
Okay, so they're not right now, but if you change your mind after you hear things, you certainly can. I'll give everybody opportunity to do so. I would just have to swear you in at that point. And then Laura, I'm gonna have to, since this is a public hearing, I'm gonna swear you in. If you please just raise your right hand. If you swear to tell the truth, the whole truth, and nothing but the truth.
Okay.
Thank you. Simple. Go ahead with your presentation, please.
So our plan is to take the suites that we identified as 101, 105, and 107 that are all former offices and combine them all to make a daycare. It would be Love and Bright Beginnings. She already has 2 locations in Monroeville, but one's a little large for her now, so she wanted to downsize a little bit. I'm hoping to get the zoning changed so we can move forward with the project and have a service in that area that is actually not present there right now.
Okay. Could you help orient us where your building is, or what?
Yeah.
Yeah. Where are we?
Right across from Corals.
Yes, right across from the Howard Hanna and the,
And Corals.
and Coral's
What
funeral home.
what businesses are you, what's beside you?
What's beside me?
Dennis store.
There's a couple.
Are you right beside Dad's
I can't remember.
Pub and Grub?
No, next.
2
one.
down.
2 down.
Two
The
down.
next site is another office building, has a salon,
Okay, you're the one
a few
beside
other
that.
things.
Okay.
Yeah, the one with, everybody calls it the ugly 70s building because it has all the arches in the front, with stone arches.
Where Dennis used to be.
Yeah,
Yeah, it used to be all dentists.
Right.
they're up, yeah.
Which used to be a very good fit for a landlord, and then all the dentists decided to sell and left.
All retired.
One guy.
Okay, any comments or issues from staff? None.
I have some questions. for
Please,
you.
Mr. Ratcher.
You are going through the state, or the applicant is going to go through the state licensing process, correct?
Yes.
Do you have your license yet, or are you still in the planning stages?
She already has a current license.
Okay. How many children?
It should be about 58.
What hours and days of operation?
I believe she's Monday through Friday. I'm sorry, she couldn't come today. She had surgery the other day. So I'm kind of speaking on her behalf. Monday through Friday, they do before school care, so I believe that would start at about 7 a.m.
Okay.
And she said her latest pickups are usually 6, 7 at the latest.
Is everybody delivered by individual car? Is that how the kids get to the facility? I assume so.
I believe so,
Yeah,
yes.
Okay, okay. How many parking spaces are available for your use her use in the lease? Excuse me.
Right now, since I only have one other tenant in there, she has about 90% of the parking spaces.
So.
And I forgot my folder, so I don't even know how many that they are. But
What happens if you find tenants for the other spots?
not quite sure yet as to parking. I know that in the past, we've had people that park in the lot next door. That my thought was also to try to contact that gentleman to see if I can lease spots for them because there is a sidewalk in between the properties.
Now, you have sort of a one-way in, one-way out entranceway, right?
Yeah.
So I would think there would be some sort of a queue of cars at the peak times. Is there a plan to manage that?
Yeah, and the architect actually has that in her drawings, that it's one way in, up to the building, and there's an allotted drop-off space. And so that people don't have to turn around or anything like that, they can just pull right through and out again. So it makes a nice U.
Okay, you don't have those drawings with you tonight?
No,
Okay. How many employees?
12.
Roughly, yeah, okay. No further questions?
Are all the entrances on the exterior to get in?
For the daycare?
Yes.
Yes.
There's not like you don't go inside, there's like a hallway to get to the different,
No.
all those are exterior entrances and you're combining those
Yes.
storefronts?
Yep.
Okay.
Mr. Weldon, are there any issues with the parking with this new development there?
Not with what was presented at Planning Commission.
Okay.
You know, there's, you know, potential 58 children, but, you know, they're not driving cars, they're being dropped off. So
Right.
there shouldn't be a big influx of parking required.
Okay, but you've seen the drawings? Is that?
Yes.
We have it in the packet.
Okay. Thank you.
Did we have it in the packet?
No, in the packet, you have the draft resolution
Yeah, okay, I didn't think so.
approving the conditional use for next week's meeting.
Council, any other questions or comments? Hearing none, is there a motion to close the public hearing for this item?
Make a motion.
And then unless you had anything else to add? You're good?
I'm good.
All right, great, thanks, Laura.
Thank you.
There's a motion, great, thank you so much.
Second.
Thank you.
Yeah,
There's a motion, a second. There is a motion, a second to close the public hearing. All in favor?
Aye.
Opposed? Public hearing is closed. Thank you. That's why we have the solicitor here. Right. Okay, so we have another conditional use approval. So is there a motion to open this conditional use hearing?
I make a motion. Second.
Okay, motion and a second. All in favor?
Aye.
Okay, this is for Pyramid Healthcare Incorporated. This is a conditional use approval. Mr. Graziani, please.
Yes, applicant Pyramid Healthcare is requesting a conditional use approval pursuant to Article 5, Section 504.c.c.c.c. Substance Abuse Treatment Facility of the Monroeville Zoning Ordinance, number 2779, to permit the operation of a substance abuse facility. The property address is 279 Center Road and identified as tax parcel 743-D-303 in the Boulevard zoning district. This evening, we'll have an applicant presentation and along with public comment. And again, in your packets, you have the resolution with conditions as it went through the planning commission. Mayor?
Yeah, thank you. So the applicant is here? We are. And representation from the, is it, all right. Is there anyone else with you this evening?
Yes, I have two others with me this evening.
Great, okay, and then there was a couple residents that initially spoke, so if anyone else would like to add testimony to this item, I'd ask for you to rise and we'll swear you in as well, so the ownership group, please. And then the other gentleman from the audience has signed in that were interested in speaking. Yep, great. Please.
You too, sir.
Yes.
Yeah, Andy, please, if you don't mind. Thank you. And once,
Sign in?
no, you're good for now, yeah. And then, once again, as we discuss this, if anyone else that's here tonight wants to add testimony, they certainly can. And then also to, the legal team from the applicant, they can ask questions of the other individuals as well. So I'm just asking that everybody raise their right hand. You swear to tell the truth, the whole truth, and nothing but the truth. Thank you all. So, welcome. If you could just state your name for the record and go on with the presentation.
Absolutely. Thank you, Mr. Mayor, Council. I'm Jeff Reese. I'm legal counsel tonight for Pyramid Healthcare, Inc. And with me, I have Jonathan Wolf, and directly behind him, Jeff Davis. They'll be presenting most of the testimony. So just as a bit of background, as you know, we're presenting this as a permitted conditional use, subject to the conditions in the ordinance. The applicant is Pyramid Healthcare, Inc. The property at issue, as stated by Mr. Graziani, is the 279 Center Road in Monroeville address. That was previously used by Independence Court of Monroeville as a nursing facility, assisted living facility. And as you'll hear from Mr. Wolf, the actual usage and the traffic created by that facility was greatly enhanced compared to this one in the way that Pyramid handles these facilities. And hopefully, through the testimony that you hear, both the residents and yourselves, council, and you, Mr. Mayor, will understand that this facility isn't maybe one that you understand typically with the amount of traffic, the inflow. This is strictly an inpatient facility. So with that, I'll have Mr. Wolf join me. First, I'd like to ask Mr. Wolf to provide a little bit of background on Pyramid Healthcare, Inc., how long you've been in business, and what it is that you do.
Absolutely. Hello, Mr. Mayor.
Welcome.
Council members.
My
My
name
name
is
is
speak up a little bit too,
Yep.
so everybody can hear you.
My name is Jonathan Wolf. I'm the founder of Pyramid Healthcare in 1999. And for 25 years, I was its CEO. I'm now chairman of the board. We founded Pyramid with one facility and 5 patients in Altoona, Pennsylvania. Since that time, through hard work and excellent service, we have grown to a company with over 80 facilities in 8 states. We have over 3,500 employees. And we'll treat on an average day about 12,000 people who have behavioral health issues. All of our facilities are behavioral health oriented. Again, over 80 of those facilities. We're probably the largest private behavioral health provider in the state of Pennsylvania, and certainly one of the 5 largest private behavioral health providers in the United States. We opened our first substance abuse treatment facility in this county in 2003. And we have continuously provided behavioral health services to members of this county since. Today, we have 3 facilities in Allegheny County. As Jeff said, the facility at 279 Center Road was a nursing home. It's closed. It's vacant today. The owners do not anticipate opening that again. It's our plan to convert that into a private, residential, inpatient substance abuse treatment facility that would have detoxification services, medical detox services run by physicians, 24-hour nursing, and would also have men's and women's inpatient substance abuse treatment. That's what it is. This is what it isn't. It's not a prison treatment program. It's not a halfway house. It's not a recovery house. All those things exist. This is inpatient acute services. The patients don't leave. They're monitored 24/7 by our staff. These patients are not well. They're sick. A lot of them are medicated. I heard some of the comments, the patients hanging out. Our patients don't hang out. They are confined, if you will, to our facility. The doors are all monitored and alarmed. We're responsible for them. We're legally liable for them 24/7. And we know where they are every minute of the day. Again, this is inpatient medical care as opposed to a halfway house where patients may come, they may go, they may have jobs, they may interact with the community. That's not what's happening at this facility.
And John, can you describe how the residents get there, the patients get to the facility, and then leave the facility as well?
We transport virtually 100% of the patients to treatment at the onset of treatment. And we transport virtually 100% of the patients home or to their next level of care when they leave our treatment. Again, we're responsible for these patients. Not just when they walk out the door, but we're responsible until the point that they enter the next phase of their treatment, be that home. Some of them might go to a halfway house. Some of them may go home. Some of them may go somewhere else. But
And on this property, there's no halfway house or step down.
No.
This is inpatient, and when they're done, they leave the facility. They leave Monroeville as Pyramid Healthcare operates.
precisely.
Sir, what type of security do you have on in-house?
Yeah. Again, the facility, of course, is staffed 24/7 with nurses and with what we'll call technicians. And these are people that are trained in security, but they're also trained in therapeutic aspects of what's happening with the patient. They manage the milieu, if you will, of what's happening with the patient throughout the day. So the facility is very highly staffed, typically on a one-to-one basis. That is one staff member for each patient throughout the day. And as I said, the doors are alarmed, and there are ample other security measures like cameras that, we have cameras all over the place. And so I would say it's a very secure environment overall. Yeah. Yep.
What about visitors? Are visitors allowed to come?
Visitors are not typically allowed, except on rare occasion. We will have family members come to a family session, but it's not family visitation as if you would have at a med-surg facility. We just don't allow that. We also don't allow patients, as I said, we pick up patients. Patients are not allowed to drive to the facility. There's no patient automobiles at the facility because we don't want them to leave and take their own car. If a patient wants to leave, we put them in our vans and we take them to wherever they want to go. Again, we're responsible for them until they hit the next spot.
So is this voluntary treatment, court-ordered treatment, both?
This is voluntary, 100% voluntary. If I could paint the picture for you, it's a very private environment. Our clients don't want to see or be seen, for the most part. They want privacy. They want to go about the work of initial recovery, and they want to go, someplace next. Again, this is the highest level of care, so most of them will go to something like maybe a halfway house after this, or some other structured environment.
What do you plan the capacity to be?
About 140 beds.
Yeah, you say the doors are alarmed. Are they locked?
Well, it can't be locked per se.
Somebody can go out anytime they want?
Yeah, because that wouldn't be fire requirements.
Okay, and this is private, so it's on the tax rolls?
Exactly. We're a tax-paying company.
Yeah, John, can you speak to that in terms of the build-out, what the cost is
Yep.
going to be, and then,
Yep.
in terms of employment in the facility as well?
No, your security, you have security on premises? And if that alarm goes off, what security do? Can they hold people and bring them back in? Or
Absolutely,
can
absolutely.
they sign documents that they can do this?
Yeah,
I don't
yeah.
have a car,
Um,
If it's voluntary, how can they be restrained and brought back into the facility?
Well, what would happen in that particular instance is we would call the police, and we would enlist their help as well. Yeah.
So are these individuals signing something that, I guess, to follow up on Mr. Kretz's question, are they signing something that leaving the facility is a criminal I guess I don't understand how that would work.
No, they won't and can't do that, but they do sign things that said that they will alert the staff if they want to leave. They will notify us that we have a process that we'll work through with them. If we're not able to successfully accomplish that, say, well, we'll take you home. Where do you want to go? Yeah.
I think the way you put it is you're legally liable to them. Is that accurate?
Exactly.
And how does that, somebody comes into the facility, what do they do? Do they sign paper? Is that what occurs at that point in time, I guess?
As in any sort of acute care hospitalization, yeah, you sign about 1 million papers, honestly. So I guess more specifically, the question is,
How are you legally liable for them? Those are the words you use. You're legally liable for the patient.
yeah.
In what way?
They're legally our patients, we're responsible for them. As any hospital would be.
They're under your care.
Yeah, exactly.
So does that mean you're responsible for anything they do also?
I mean, certainly if somebody would cause an intentional
If
act,
someone elopes,
pyramid
the
would
gentleman
not.
was concerned about his business, so if someone elopes from your facility and goes down to Charlie's Ice Cream and commits a crime there, you're not liable for that, right?
That's correct. Yeah, if somebody left against medical advice and went and wanted to commit a crime,
So ultimately,
the
you're
pyramid
not.
wouldn't be liable for that crime.
So
I
ultimately,
think-
you're not liable.
Correct. What Mr. Wolf is saying is they're liable for the care of these patients at all times. They take on the burden of
But
transportation.
not
like he
liable for their
testified to.
conduct.
Correct. But maybe I could ask
Outside the
this
facility.
question for Mr. Wolf. In your experience, do you have people that try to escape, or because they're always able to leave with the staff's help, is that what actually occurs?
It's very, very rare. Again, if you know that there's the offer of transportation, why would you do otherwise, So. it's-
Well, we're not concerned that it's a safe facility. What we're concerned about, that one individual in 5 years gets out there and kills somebody or goes down there and beats up the people at Charlie's Ice Cream or attacks a kid. We're just worried about that one time. And how you can prevent that without the doors being secured.
But that could be true of any hospital setting.
Yeah,
Someone
right.
could leave a
Exactly.
hospital
That's right.
that's unwell and cause problems.
Unfortunately, in the society we're in, that could happen literally anywhere,
Right.
anywhere we are. That could happen here tonight, God forbid.
Yeah, but this
You know,
is
the
different.
idea
You have a
is-
high, your clients are a different population. They're not
Correct.
the average, like, you can't compare it to the average person in this room, right?
No, but like John said,
And
these
saying
people are
that
sick.
they're reasonable, and if they want to leave, they'll just ask to leave, because that's the reasonable thing. Well, the reasonable thing would have been to not become addicted also, but they went and did that too, you know what I mean? So people here need to hear, like, what is your incidence of, elopement with your patients, and how have you handled some of those? And when if someone leaves and you call the police are going to show up and say, what do you think we're going to do? He wants to leave. Police aren't going to detain that person. And do you have a copy of the agreement that they signed? Do you have a copy here tonight of the agreement they signed with you, what the terms are?
Not with us tonight.
Okay.
So, well, one other pieces, so let me be sure I'm clear. So there's no patients that are on an involuntary commitment?
Correct.
Okay. So there are no patients that are admitted for any type of proceedings that have gone through the court process that restricts them from leaving or traveling from there? It's all voluntary?
Correct.
Right, okay. All right, that's fine.
I would like to see copies of what they have to sign. If you could present that to us prior to next Tuesday, I'd appreciate that.
Happy to.
Can we go back to security for a moment? Are there persons, security guards, do you have security guards at these doors, or what does that look like?
Again, the patients are involved in activities from the moment they rise until the moment they go to bed. So there's staff with them at all times. And so I would say, in that sense, you just have to put in your mind that there's a lot of staff at the facility, at the building. Is there a security guard standing at the door? No, it's not necessary. But there's people who provide security with the patients in group therapy, education sessions, doing the activities that they're doing, and monitoring their activities and behavior.
Well, is it limited or badged access from the outside? So you're describing how the treatment plan. They're there. Plus, I'm surprised they're 140. I'm interested to hear that build-up because that wasn't how big that facility was. to do that. But, anyone be able to enter the facility without being badged in, accessed, or restricted to come in.
No, absolutely not.
You mentioned you had 140 beds, then does that mean you had a one-on-one participation with
I was gonna ask
with
that,
the
Bob.
people?
Yeah.
So do you have 140-plus employees at that facility?
I mean, ultimately, it's possible. Typically,
Well, no, I'm not asking if it's possible. You said you
Yeah.
had 140 beds, which means you have 140 people. And then you said you had one staff for each person. Well, that makes 140 and 140. Now you're saying maybe not.
well, I doubt that there'll be 140 patients there at any one time.
Okay.
Because you have men, you have women, it's two separate units, you have detoxifications, you have three separate units. They would have to all be full at the same time.
Okay.
So, your census is always substantially below that. Maybe not substantially, but
I see.
it's below that.
Yeah, we certainly can't commit to a one-to-one ratio, but, based upon, vacant beds, open spaces.
Well, no, that's
there
what
will be
he
a large
said,
number.
one-to-one ratio.
He said it could be, yeah.
No, he said it is a one-to-one ratio.
He did. He did.
Well, it's been cleared up at this point.
Yeah.
Yeah, and John, can you speak to then, sort of the community benefits, the build-out, the costs, use of local contractors, things of that nature?
Yeah, absolutely. We'll invest initially somewhere between 5 and 6 million into this, sort of bringing this building back up. And then our annual service costs, salary, wages, benefits, services, somewhere around $9 million that we'll sort of invest back into the community annually. Use private, local contractors wherever possible, and obviously local services as well. And, the 100-plus employees will certainly buy services here. Hopefully, some of them will move here and buy their services in Monroeville. So, yeah.
In addition to Pyramid, which have heard before in the past, is there any other folks in the industry you would compare yourself to? Other organizations that provide a similar service?
Sure, I would say probably in Pennsylvania, the one that's as large as us and provides similar services is called Acadia, A-C-A-D-I-A. Yeah. That would be the closest comparison, I would say.
Sir, what substances are most of your patients treated for?
Well, there's good old alcohol, and that's always number one. Opioids, all kinds of opioids, be they prescription opioids is probably number two. Could be heroin in some cases, but I would say alcohol and prescription opioids, one
Okay,
and two.
and do they pay for your service? Is it usually out of pocket or self-pay or insurance or both?
It's a combination. The two largest payer sources will be commercial insurance and government, Medicare or Medicaid. Yeah.
You speak for a minute about your regulatory regime, who regulates you.
Yeah. It has to be one of the most highly regulated services, I would say, certainly in this state. We're licensed by the Pennsylvania Department of Drug and Alcohol Services. Annual inspections, 3 days, they bring in a whole swarm of inspectors. And I'm not quite sure how many regulations they inspect, but it's a lot. All the way from physical plant to how we're treating the patients, how we're discharging the patients, very thorough. That happens annually. And again, that's annual state license. And we also participate in the Council on Accreditation of Rehab Facilities, which is a national accreditation that we go through successfully every 3 years. And it really measures you against national standards of quality. And again, we're fully certified by CARP, is what they go by, shorten it. So, And then we have our payers also do inspections of our facility. UPMC is a very large payer of ours. They do inspections of pretty much all of our Pennsylvania facilities. The single county authorities that control county monies, and we have a very large county contract as well. They will do an audit of the facility. Other payers will do audits, sometimes commercial payers, Cigna, Blue Cross, and some other of the Medicaid MCOs will do surveys. So I would say in the course of a year, we probably have at least three or four different surveys that occur, inspections of our facility. Highly, highly regulated, for sure.
And what do you do for training of staff?
Very extensive training, supervision training program in therapy and patient management. We do a lot of online training. We have a whole application system to do online training for our staff members. You have to follow a mentor for a period of time before you can actually, treat a client. A lot of our therapists are master's level trained, some at the PhD level, but it's a very highly educated treatment team that participates in this. So,
Great. Before I bring Mr. Davis up, anything else you want to finish with?
I think that was it. I'm certainly open for additional questions.
Sure. I'm going to bring Mr. Davis up. He's the engineer, but if anybody has additional questions for Mr. Wolf, please do ask.
I guess I would ask one last question. Is there I guess you don't have security staff there. I guess there is a key card to buzz into the door, it sounds like. Is that accurate?
I don't think that was the answer.
How do you get into the facility? How does somebody get into the facility? How would a visitor get into the facility? How about that?
That's a better question.
Front door. That's the only way in.
Are they allowed, do they just walk right through? What prevents them from bringing some type of contraband into the facility?
Yeah. Jeff, you may just want to. You're
Sure,
the one that
that's
designs
fine.
these systems, so it would answer it best.
Good evening, I'm Jeff Davis, I'm the engineer for Pyramid Healthcare. I designed the security systems as well as the construction and renovation of the project manager, so forth. So in the case of the safety of clients inside the building and people trying to get into the building, I think that's really the question.
Yes.
You're asking. Every door is locked with a mag lock, 1,200, 1,400-pound mag lock from the outside to the inside. So no one can come into the facility unless you've got more than 1,400 pounds pressure, get through that door, without a key card that, like any key card, is used anywhere. You badge it from the outside, door releases. You have to be a staff member. We track the staff members. We audit the trail of where the staff members go. Every door they go through is called an audit trail, and you can virtually pull up any staff member and see in their 8-hour shift exactly what doors they went through, what time, what key card, so forth. So anybody that's coming as a visitor is going to come through that front door. Front door has, obviously, has an RFID staff badge reader on the outside as well for staff. But if you are a visitor, let's say you're an unwanted visitor, that's really what you're asking.
Correct.
There's a person at the front desk. That door is locked from the outside, as every door is locked from the outside. You have to physically press the button, talk on a microphone, talk to the front desk person.
That was your question.
And that person will buzz you through if you're appropriate. If you're not appropriate, you'll never get through that front door. And that's where you go, and you'll go into reception area.
And that's a 24/7?
24/7, yes, sir. And when it's not manned at the front, the nurse's station, let's say, someone at the front has to take a break, The nurse's station has the same video camera and microphone and switch to operate that door to let them through.
So now, do the patients have like a list of visitors that are allowed into the facility? How does that, I guess that's the first question. Is there a list of visitors
I
that,
think there's only I'm not on the operations side, but I've been here for 22 years. It's mainly family. Yes, there's a list of family members that are approved to come in.
And frequently, there aren't many visitors. This isn't a constant flux of people because of the nature of the treatment and the intensity of the inpatient. Again, it's like Jonathan said, this isn't med-surg where people are in typical recovery where they're watching TV and getting better. They're actually in sessions, one to the next, or in some sort of detox state where visitors probably aren't even permitted at that level of care. So very little traffic, and I'll use that unless you have other questions as a jumping off
Well,
point.
let me just add
Sure.
one more thing on the safety side. We have virtually about 100 cameras inside and outside this building. There's not a section of the building, you cannot walk up anywhere close to the wall of the building that you're not on a camera, that you're seen by staff. So 100% cameraed outside and about 70 to 80 cameras inside. The staff and the clients are totally within camera range all day long, entire shift.
In terms of traffic the facility generates, can you just speak generally to that? I know we submitted a traffic study with the plans, but just to summarize.
Yeah. We asked for the variance, I think it was 169 was what was expected through the ordinance
That was for the parking.
for the parking. Oh, you want traffic first? Traffic,
Yeah, whatever order you want to go
yeah,
into.
okay. Well, traffic, none of the clients, Mr. Wolf explained, none of the clients drive. So we don't have that in and out traffic. The only thing we have is staff members, first shift, second shift, third shift, normal change in the parking lot, just like it would be. And we have various deliveries, food service, UPS, FedEx. That's the traffic that's oriented towards the building. Again, no client vehicles on site, no family members coming, totally restriction of the amount of traffic that the facility has.
What do you need a variance for then?
The number of parking spaces.
Number of parking spots.
Based on your ordinance, which is based upon the gross square footage of the building, 196 parking spaces were required.
Question for Paul. If we give them a variance for parking and they sell the building, what happens to that variance? Does it go with the building, or can we take that back?
It goes with the property,
No, once a variance is given, it's forever.
correct.
What about its former use as far as the building, the nursing home? Were they within our parking ordinance?
I don't know what the parking requirement was, it was a different ordinance back then.
Okay.
I'm not looking for that for Tuesday.
Well, just so the council's aware, we already received the variance from the zoning hearing board for the parking.
Oh, you already got a variance?
We did
Well,
last month.
That's out of our hands
Yeah,
then.
we're good.
Correct.
And we're upgrading the parking by 22 spots
Upgrading the parking?
from what was there originally.
Correct. I believe there were about 46 spaces
42,
previously,
yeah,
and we're adding it up.
Well,
We're
it
going to have 60.
don't matter if you already got the variance.
Correct, but just so council's aware,
Okay,
yeah, there will be
thank you.
over 60 parking spaces, and that's going to take us to one of the other issues, stormwater management and control. I did put in place of everybody's seat tonight, the stormwater report that we have so far, which will provide the measures that will be in place. Shreffner and Company prepared that, but Mr. Davis can speak to, sort of what the plan is overall of controlling stormwater. And Mr. Wielden also brought up an issue existing on the property with a pipe that will be controlled as well.
Let's back the bus up here for a second, if you don't mind. We talked earlier about 140 beds, and it was unlikely that there'd be 140 there. But if there's 100, and you got 100 employees there, you don't have enough parking spots.
Well, that's over 3 shifts.
Okay,
So first shift, second shift, third shift.
okay,
And then your biggest use of
30,
parking
60,
is
90,
first to second shift, shift change.
gotcha. Thank you.
Yes, sir.
Sure, in terms of stormwater management?
In stormwater management, because we've upgraded the facility for an additional 22 parking spots. We have this condition called impervious versus pervious. I'm sure you guys have heard about it. So we're adding asphalt now to what used to be grass area to accommodate the additional parking spots, which gives you stormwater runoff that naturally would have gone through the grass, now is on the asphalt. So we've had to prepare a stormwater management plan, which is typical of anybody adding additional asphalt. Scheffler and Company has created the preliminary plan. We've submitted that to Mr. Wilden. And it's going to involve 2 infiltration tanks, a 40-foot by 14-foot tank on the right side of the property, and a 100-foot by 40-foot tank on the left side, subsurface, under the asphalt. It'll be manage the slow water retention and output from anywhere from a 1-year storm to the 100-year storm. All that's been applied for in design, and the permanent plan will be forthcoming.
So there's no detention ponds, it's underwater storage?
It's underwater, yes, sir.
Yeah, my understanding, speaking to Mr. Wielden, your engineer will review the plans too, and as a part of any approval, having to have a approved stormwater plan. So we'll make sure that that's in compliance. Additional matters of compliance, and I'll just have Jeff answer these. Will Pyramid apply to all, or comply with all the applicable building codes?
Absolutely. We'll have to get anything we do in that building, we'll have to go through the normal process. Submit engineer drawings, stamped engineer drawings, go through the building permit phase. Yes.
And as residents are there on a 24/7 basis, will they also receive food service licensing?
I happen to run food service for 18 years, so I can answer that.
Okay.
Yes. Yes, so we use a local food service proprietor here in the local area, and there'll be a food service license, mostly Department of Health, is who we'll have to deal with, and they'll come in and inspect on a regular basis.
And in terms of frontage and access, this building has frontage on Center Road, is that accurate?
Yes, that's correct.
And our separation requirements, the conditional use section requires that the property not be located within 500 feet of a school, public playground, or the like. Will that be complied with?
Yes, sir.
It's one way in, one way out, right?
Yes.
It is, there is one driveway in, one out. Correct. And it is relatively well screened off to the way the building is situated currently as it stands without any additional work, which I believe some will go into it. Waste collection storage must be 50 feet from the nearest building. Will that be maintained?
Yes, it's on the back of the property,
And
more
that'll
than
be
50 feet, yes.
And that'll be screened as well?
Mm-hmm, yes.
And will mechanical equipment be screened?
Yes, sir.
And lighting, will that be ensured to be down lighting and not to impose on any adjacent properties?
That's correct.
Okay.
Stay within the property lines.
Enclosed dumpster containment?
Yes, sir.
And the signs will comply with all signage requirements for Monroeville?
Yes, we'll most likely have to get a sign permit, yes.
And I think it's pretty clear, but the only use in this building is for Pyramid Healthcare, is
That's
that
correct.
accurate? Okay. Any questions for anyone for Mr. Davis?
Is there any other fencing or any type of barrier between, around the parking lot?
There is no fencing on the property lines at all. It's all trees, shrubs, so forth.
I guess if you're looking at the building, Charlie sits like down below to the front right side of the building as you're on Center Road, if you're looking at it. Hypothetically, I mean, is there a way to get from that area, from that down to Charlie's?
There's a steep fall off right there, about 15 feet, I think.
And there's no barrier there at all?
It's not a barrier above the retaining wall, no. But it's a wooded area.
Is that something that you guys, could there be a barrier placed there?
There could be, yeah.
Is that something that you guys would consider erecting?
Well, again, it's a 10-foot, 15-foot fall off of there, so we could take a look at it.
Yeah, all right.
Sure.
Well, that's what we're trying to prevent.
Yeah.
Any other questions at this point for the
couldn't see putting that-
applicant or the legal representation? There'll be another chance later, of course, we're going to leave the hearing open. There were some people from the audience may want to add testimony for the applicant. Sir, come on up.
Thank you.
Well,
Well, your testimony is, come on up and say whatever you want to say.
Yeah. And if you have a question for the applicant.
So if you have any questions, or if you just want to add testimony, comment,
I signed the book before, by the way.
you can just state your name for the record.
My name is
please.
Gary J. Schema,
Welcome, Gary.
and I'm sort of like around the corner from this,
Swear 'em in.
which used to be a nursing home, which my mother was in for 6 months or so. Nice nursing home at the time. But it's within walking distance of my office, Nationwide Insurance on Center Road, and my one tenant that I have back who has a child. And that does bother me. The Monroeville residents are affected by having this kind of situation coming to Monroeville. It should be a nursing home, which was before a very good one. And by the way, you could walk around, 20 feet to get to his ice cream place from this place. So it's really close to his ice cream place. But I don't blame him for being upset about it.
All right.
Me too, though. I think I'm done. And I can see why they brought 3 guys here. Because they needed 3 guys. But when they talked, I feel more strongly than I did before. And you guys, I hope, do too, against it. We don't need this in Monroeville. It needs to be in the country somewhere else, with good security, too. Okay?
Can I add one more comment?
Sure.
please?
Yeah. And Andy, I know you come on up to the microphone.
Sorry.
And, yeah, no problem. I know you spoke earlier, and that's in our minutes,
Yeah.
but it wouldn't be a bad idea for you to just repeat.
The only
That's
thing,
sometimes what you
the
said
thing that
before.
really bothers me is I never want to see people not treated or drug addicts, but the experience that I've had over the years with these ex-addicts, quoter addicts, is most of them end up back on whatever it is that they started on. I don't care what treatment they get. And I'm wondering if the people going into this facility are forced to go there because it's part of a plea deal or something for some crime that they did. So they have to attend this.
Well, I believe that was asked earlier, and I think the answer.
Was it?
Yeah, the answer was
The
no.
answer's no.
Okay, so none of these people are, you wouldn't know that, though, if it was a plea deal.
Well, they said it was, they did, the gentleman did answer that it was, they are all,
Okay,
they were.
well, that's one thing I was worried
voluntary,
about.
Okay.
But anyway, but I still think for Monroeville, it's a bad idea. Thank you.
Yes, hi, my name is Albert Lardo. I'm the owner of William Penn Village, 2 doors over. I built that place in 1994. It's a great center. I have good tenants in the building. I'm vehemently opposed to this whole setup here. This is going to bring Monroeville, that section of Monroeville, into the toilet. I don't believe that that type of facility should be in the heart of Monroeville amongst kids eating ice cream, people in the neighborhood, my tenants walking in and out of the parking lot, my customers in and out. This should be located in a remote section of Allegheny County somewhere, not in that particular building. I thought for sure it would be located somewhere else. There's a company called Allies for the Health, and they take people out of prison, okay? They take them literally out of jail and they put them in like a halfway house, or it's some type of a treatment setup, or they place them in Section 8 housing. They put them in there and they see how they can live on their own. These people have to be monitored, just like you monitor day and night. And we just can't afford to have people just, if they walk out of this facility, they have no liability on those people if they hurt somebody. You said we have maybe a liability while they're in the building, but what happens when they leave the building and they walk out and do something? That's my concern. I think Monroeville is on the incline right now, starting to go up again. I think this will bring it down. That's my comment.
Very good.
Yeah.
State your name, please.
Heidi DeWitt.
And Heidi, I don't know if you stood up at first as far as.
I
this one.
didn't.
Yeah, no problem, if you don't mind. you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
Am I allowed to address you?
Yeah, so if you don't mind, just speak to us because it's the microphone. No, stay where you're at.
Oh.
And he'll hear you, and,
Okay.
but if you just,
So that you're recorded.
I know you
just
want to
wanna-
speak to his face, however, if you don't mind, if you put your
I
comments
just
towards me.
am hoping that you can reaffirm, because I believe that when you did answer the question on, are these people voluntarily placed there? And with such affirmation, you said yes. But then also, and please correct me if I'm wrong, once they're finished with the treatment program, we will transport them to halfway house, home, or wherever they want to go. Is that not correct? Did you not say that? Gentleman with the gray hair?
Yeah, Mr. Wolf. Yeah, Mr. Wolf, if you want to,
So you did say that. So if they're there voluntarily, why are they going back to a halfway house? If they're there voluntarily, of their own free will, because, again, they're cognizant enough to make some sort of voluntary commitment to you, they can make this commitment because they're not on Suboxone or methadone or anything else, so they have clarity in their thinking. Why are they going to leave your facility? What would cause them to have to go back to a halfway house? Hoping you can,
They need,
Mr. Wolf, I'm sorry, just so to the microphone, if you don't mind.
the process of treatment, the research has shown that if you're in substance abuse treatment for at least 1 year, your chances of staying sober or drug-free are greatly increased. So you are going to be at our facility for 3 days, 2 weeks, and ideally, when you leave there, you go to a halfway house, or you go to outpatient treatment. You stay in lower levels of care for hopefully up to a year. You continue that treatment. So that's the normal course that people who leave our acute level of treatment go to the next level. And sometimes that's a halfway house, sometimes that's
so after
outpatient.
3 days of treatment, they would, isn't that what you just said? Sometimes they're there for
Could be.
3 days?
It could be.
So then they're gonna go to a half, because they're cured after 3 days. And so
No,
then.
no, no. Didn't you hear me say that, first of all, you're not cured from this illness. You live with it for the rest of your life. You should know that. Second of all, the longer treatment you have at reducing in severity of treatment, the better your chance for success. So ideally, everybody that leaves our facility goes someplace else at the next level of care to continue their treatment, ideally for a long time.
So
Which
if
is
they-
phase one.
So if they voluntarily say, okay, I've been here, I'm addicted to opioids, and I've gone through your 3 days or a month treatment with you, and I feel as though I'm ready for the next step, because I really want to commit to this process. Okay, so how is that benefiting Monroeville? How is that person coming out that has a year yet? They have to prove it for at least a year, so that way they can really fight it. How is Monroeville better for this? How is Monroeville going to be better because of your service?
Well, first of all, the patient's no longer using alcohol or drugs.
I'm asking Monroeville. How is
If they-
Monroeville?
I'm assuming if this is a Monroeville citizen, that they've stopped actively using chemicals or alcohol, and they're on the road to recovery. How does it benefit Monroeville if they go to a halfway house in Erie? Well, it doesn't really. Should it?
You're moving into Independence Court. How is that better for Monroeville?
Employment. We're helping people, again, who have active addiction, who are driving, who are citizens of Monroeville, who are driving the streets of Monroeville during their active addiction. We're taking them off the streets. We're returning these people to productive lives. We're infusing $9 million a year in salary, wages, and benefits and services. we're taking a building that is empty and will start to deteriorate. We're putting it back on the tax rolls. So, shall I go on? So
I really do want you to go on, because it's still not making, it's bettering you, but you're not bettering Monroeville.
Oh.
And are all of these 140 beds that are available, is that just for Monroeville? You're not having people from, like, we'll just say Wilkinsburg and Turtle Creek? It's just simply for Monroeville addicts?
It's for Monroeville and the surrounding areas,
Okay,
yes.
so, yeah, okay. I don't, okay, that's all.
Sure.
Okay.
Okay. Well,
Thank you.
thank you, Mr. Wolf.
Mr. Wolf, is your facility mainly a detox facility?
Mainly, I would say not mainly, because detox is a shorter period, and the unit will be a little bit smaller than the rehab
You
facilities.
seem to say that patients were there like a few days.
Well, I used one case.
okay,
It-
so-
It could be a day at the least.
Or
the
most?
Several months, potentially.
What would you call the average?
I would say probably about 19 to 24, 26 days is the average. Yeah.
But to be clear, we talk about people coming there voluntarily. So these are individuals that have an issue, they recognize they have an issue, and they're coming to your facility for the health to get better, right?
Absolutely.
They're not being court-ordered there, they're not being forced against their will. These are individuals that are sick, and I think everyone in this room knows somebody that has gone through alcohol abuse or has had drug issues or problems. And yes, some people in those situations, they do terrible things to their families, to the public. However, we all know people that have these kind of issues that come from good families, they're good people they have a problem. So, but these are people that are recognizing like, hey, I have a problem, I need to get help, and then they come there, and for what I'm trying to understand, and I'm trying to hear it a little bit, is, so you're like at the highest level acute care. So similar, so if someone goes to the emergency room for a problem, because they're having a major problem, well then, once they're cleared from that phase, maybe they're stepped into the hospital a little bit, maybe from that point, they're stepped into like a nursing home, or maybe to outpatient care. Is that kind of similar how it is? So when you say the highest level of care, you're really at the first step, and that's why it might be 3 days, 9 days, 20 days, and then the mention about like the halfway house, maybe the next step is a halfway house or a different type of facility.
Mr. Wolf, would you say that the
always.
quality of care, the style of care would be equivalent to Recovery Centers of America folks provide?
Our RCA does provide more acute residential services at some of their facilities, yes.
Okay. So, I mean, we have, the rest of it too, we have inpatient residential rehab facilities in Monroeville. We've used them for a long time, okay, and they're here, they're in place to it. And so I'm just trying to compare that to everyone to understand that even that treatment then, when you say highest level of care, you're referring to rehabilitation treatment for drug and alcohol abuse, which may or may not, would not necessarily include tertiary care inside of an inpatient facility, such as cardiac monitoring or things along those lines. However, supervised oral medications, supervised IV medications?
No.
Okay.
We don't do
Supervised
it.
oral medications and then other treatment and therapy that goes along with that style to do that.
Exactly.
Okay.
But individuals aren't, it's not, say, like a Suboxone clinic, individuals aren't coming there, receiving the treatment, leaving, coming back the next day, they're.
Yes, we have those too.
Yeah. No, it
That's
is
not
not that.
It is not that.
It is not, absolutely not that. Yeah.
Block and a half.
Yeah. Yeah. Yeah.
Stan, and then I'll come to you. If you please just sign in, if you haven't already. And if you, thank you. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
Yeah, my name's Stanley Beck.
Thank you.
Just so you know who I am, I'm Elizabeth Beck's husband, because I know she's well-known here. Yeah, so I was listening, I don't know whose side I'm on, but I think, these kinds of facilities do good work. And to say, well, not in Monroeville, well, what's the population of Monroeville now, about 20 or 25,000?
29, almost 30.
29,000. We certainly have our share of people who need these kinds of facilities. And we could go to a facility in Monroeville, or we can go to a facility somewhere else. And it sounds to me like these people are well monitored. Now, some of it was kind of vague. I think you asked some good questions. He said one-to-one care, and then we talk about parking. Well, 140 beds, that means 140 employees. But no, it's over 3 shifts. To me, that's a 1-to-3 care. So maybe it's not, maybe they're exaggerating a little bit. But it sounds to me like they do good work, and our community could use a place like this, and other communities, people from other communities are welcome to come to Monroeville. And Monroeville, I think it is, it was on the decline, and I think it's coming back up. And I think a facility like this could add something to Monroeville.
Thank you.
Can I make a comment?
1 second, this young lady. No problem.
I wasn't going to say anything.
You are permitted. And we swore you in once, but we're going to swear you in again for this.
Okay.
Yeah, different hearing. And state your name.
Laura Bartolomucci James.
Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
So before I was in real estate, I happened to be a drug and alcohol counselor. I have a master's in counseling psychology and have worked anywhere from Western psych, inpatient, like totally locked down facilities, to halfway houses, to just doing assessments for drug and alcohol to facilities just like yours. I also had Gateway as a tenant for, 10 years, whenever they were on Northern Pike. I think just because, I don't want to pick on anybody or anything. I'm just trying to kind of help you guys maybe understand a little bit more about the patients that would be going there. I've worked in a facility that all we accepted was voluntary patients. I've worked in a facility that was completely court-ordered. They are two very separate patients. The ones that come that are voluntary they want to actually be there. They're not the news stories that you see. I mean, and I will admit that the one facility I worked at, it was like Channel 4 camped outside of it because somebody was going to do something crazy. But they were all the ones that were referred there from CYF, or I had to go to the Allegheny County Jail and pick up and bring there. The facility that he's opening, or wants to open, is a highly I feel in my experience, would be a highly motivated patient that's not looking to run out the door and hurt anybody. And somebody said about, that we have some of these centers here. My niece, unfortunately, is an alcoholic and just had to wait to go into a facility for I think almost a month for a bed to open up. She's 25. She wanted help, but still had to just sit around and, was drinking daily, so in danger of some severe detox. So it is, unfortunately, it is a necessary thing. The other thing I heard of was, how is this going to help Monroeville? I think most of the general population doesn't realize that alcoholic, that person that's addicted to opiates, is very easily your neighbor, the woman that cuts your hair, the guy that you see every day at Giant Eagle. It is rampant, and trying to think how best to term this. It's a rampant mental health crisis, and it can only actually help, I think, this area and surrounding areas. Whether it's Monroeville or Murraysville or Wilkins or Churchill, wherever it is. So that was my 2 cents, and I figured I'd offer up any expertise if somebody has a question about the actual field or anything.
Thank you.
Okay, I'm done now.
Great. The hearing, I'm still leaving the hearing open. If anyone would like to add testimony.
If you could state your name, sir.
Once again, I'm Andy Yelch again. One thing is, I worry about my real estate and buildings there declining in value. I don't want to be next to a place that does rehab on drug addicts or anything like that, because we know for darn, I don't care how you sugarcoat it, it's going to be a dangerous person, can walk out of there at any time. And I'm asking the council to please vote no on this, because I've lived here for a long, long time. And I think it's a bad idea. I think there's something much better that you could do with that property on the top of my buildings up there. That's all. Thank you.
Yeah, and I'd like to also say that no matter what the explanation is you hear tonight from the petitioners here, you don't really know what you're getting into. When it comes to the type of people, the type of funding that the developer is looking for, it's not self-pay like this other company you're talking about, where these people have money of their own, they have to pay for the treatment. They're talking basically government money, Medicaid, Medicare, whatever, but it's not self-pay. Self-pay is, if you're really up straight, you're going to pay for it, the service, and you're going to have a result.
Or commercial insurance will pay for it.
Or commercial insurance, correct. So it's not like, I think it's just a giant can of worms that you're not even aware of what's happening here. Thank you.
Your turn.
You could state your name again. Georgiana Woodhall. I'm very familiar with Recovery Centers of America. I was on the Planning Commission back then, and I'd like to know, how do they differ from this facility? We already have recovery centers, and how many of these facilities do we need? I mean, this is location, 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 is what they say. That is not a good location there, where they're proposing this. If you think where a recovery center of Monroeville is located, off of McGinley, I believe, at the end, it's isolated, but it's in a better location there than next to where they want to put this. I think that's a very bad location, and I would ask you to think about it as far as the need. As a taxpayer in Monroeville, I don't see a need for another one. I think I would definitely ask you to deny their request. Thank you.
Is there anyone else like to add testimony?
One more.
You got to come over. You got to come over to the microphone and get sworn in and sign in, and everybody else did. So take your time, and if you just sign in.
Okay.
And then if you could just state your name for the record.
My name is Deanne Skeena.
Deanne. All right, Deanne, if you please. You swear to tell the truth, the whole truth, and nothing but the truth.
Yes, I do. Yeah, I just had a couple comments. One, you had mentioned about it being in a facility of schools. If you were to face that building to the right, across from his location, is daycare, toddlers. To the left, if you go towards Fox's Pizza, preschool, toddlers. If you go on Center Road behind it, preschool. The church, Mum Preschool. If you cut through that road that goes to the Independence Court, you just keep going to the office building behind it, you're in Garden City Drive, in everyone's backyard, and Divine Mercy Academy. A whole school right there, Catholic school. So you've got 4 of these things right around this, and you're talking about putting something in there. I mean, it's awful. It's an awful idea. It's, like she just said, it's a lawful location. You know, the other one's by the hospital and things over there, but not here. You have all these preschool children around there. You have the ice cream place with the children, and the St. Bernadette's, which is Divine Mercy Academy. You're going to have, if someone gets out of there, I mean, I wouldn't say that they can't you're talking about going there to the ice cream, but their driveway goes right to the office building behind there in Garden City Drive, Divine Mercy Academy. So they're all right there around this location, which is the main reason that is not a good idea. I mean, that's all I wanted to say.
Make sure that's it.
I will leave the hearing open if there's anyone like to add testimony to this conditional use hearing. Seeing none. Council, any other questions or comments?
I'm sure it needs a break.
Yeah, we're getting there. We're getting close.
I have a comment.
Mr. Crut, please.
So I retired from Monroeville Police 28 years. When the rehab went in down McGinley Road, I thought, oh boy, this is going to be chaos, drug addicts everywhere. We really haven't had any problems from there. Occasionally someone leaves. I think we have more elopements from Forbes Hospital than we do from, from the psych ward at the hospital there. And then when the other place went down here on Monroeville Boulevard, the Suboxone Center, I thought, oh, this is going to be chaos too. Really, it's nothing, And if someone does elope from their facility, I don't think they're going to be hanging around. If they want to leave, they're going to beat feet and go somewhere. They're not going to go down and hang out at Charlie's Ice Cream or try to hang around for the police to find them when.
Sorry, that's a variable that you can't judge what anybody's going to do at any time. That's all.
Well, in that,
No,
I
but I'm
wouldn't say about
giving
any
you two
business.
examples of where it didn't become a problem, and I was looking for it to be a problem. You know what I mean? And it just didn't materialize.
But that doesn't mean it can't happen.
No, that's right.
And the proximity.
Yeah, let's stick with the hearing at this point, because you gentlemen both have your testimony in. Your stance is very clear. We understand it, and so does the applicant, absolutely. The applicant, legal team, anything else, any follow-up questions from the testimony or follow-up statements or anything else you want to close with about the project?
Yeah, please, and I'll just take a minute. Just as an example, I think, anecdotal, but something that I'm familiar with personally through someone that I know. And the question was, does somebody go from here to a halfway house and sort of, does that happen? I'm familiar with somebody who, because of their addiction, wasn't able to pay their rent. They were evicted, and but for a place like Pyramid, they had somewhere to go. But when they were done with their intensive inpatient stay, they had nowhere to go. No family, no money, no job, and they needed a step down, which was a halfway house. And so that provided them a place to go, to get a job, to find somebody that could help and provide that. So that's, in accordance with Mr. Wolf said, that's sort of how these facilities can work, depending on the person that's in there and the patient. I think as this council and Mr. Mayor, you're aware, this is a conditional use application. So this council has already decided that in this commercial zoning district, a substance abuse treatment facility is a permitted use subject to the conditions of the ordinance. We went through the testimony tonight and addressed all of the conditions and submitted all the materials to meet the conditions. So with that, we would ask that the approval be granted because we do meet the conditions and it otherwise is a permitted use. And certainly rely on the testimony then that if there is a benefit to the community, there will be an influx of money, jobs, taxes, wages. So there's certainly substantial benefit surrounding Monroeville, and these guys do it right. They build a nice facility, they put the money in, they know what they're doing. This isn't a fly-by-night company that just comes in, does a poor job, and endangers the community. They want to be there a long time. It is a for-profit venture, so their goal is to be successful for the long term, and that's why they're going to do a good job and do it right, and be a benefit to the community. We certainly understand, people's concerns. They're heard, and the facility will be done right. We appreciate your time. Thank you again.
Thank you so much. Council, any last statements from council? Once again, this is not a voting meeting, so council has a week to consider this, and this will be on the agenda for next Tuesday. There will be a public comment period prior to any vote next Tuesday. It won't be part of this testimony this evening, but there will be a public comment period prior to any vote next week. But Thanks to the applicants for coming out and spending time and explaining things, and for the residents that came here to stress their concerns. But with that, is there a motion to close the public hearing?
Motion to close.
Second.
Motion is second, all in favor?
Aye.
Opposed? The public hearing is closed. We still are in our agenda-setting meeting. Yeah, I'm getting, yep.
We need a
Yep,
break.
yep, exactly, yep. I didn't know if you had to add something legal. Okay, yeah, so the public hearing's closed, but we are still in our agenda-setting meeting, but we're going to take a 10-minute recess for the stenographer, and we'll be back into our meeting. All right, this meeting is back in order. We just completed our conditional use hearings, and now we're moving through our agenda-setting meeting. I do have an executive session announcement. The council conducted an executive session this evening, Tuesday, April 1st, from approximately 6 p.m. to 7 p.m. for matters pertaining to legal, personnel, and/or real estate. Council legislative action, if any, will be taken at next Tuesday's April 8th regular council meeting. There will, once again, as I mentioned earlier in the meeting, there will be a public comment period prior to any kind of a vote next Tuesday for agenda items only, and then there'll be another secondary comment period for any municipal item at the end of next week's meeting. So, council, the minutes that we are going to be considering for next Tuesday are for Citizens Night meeting of March 4th, 2025, and the council work session meeting of March 4th, 2025. Any questions or comments about those minutes? Hearing none. Reports of the tax collections for next Tuesday. Any questions or comments? Hearing none. The list of bills and budget transfers. Council, any questions or comments? Hearing none. And the payroll report. Any questions or comments prior to next Tuesday's meeting? Once again, this is not a voting meeting, but all of these items will be considered, and action will be taken on them at next Tuesday's regular council meeting. Item number 6, bids and proposals. We have two, the 2025 commodity bids, and also we have the 2025 surplus vehicle equipment auction. Mr. Graziani, please.
Yeah, in your packets, there's a memo from Jamie Story dated March 29th. He did put together an outstanding synopsis of all of the bids that have gone on, and just want to say way to go to the team putting that together. He enumerates how we improved getting bids. I would like to call your attention, besides the highlighted parts that Jamie made convenient for you to review, and you'll be voting on next week. In the last page, he has a couple comments related to the challenges we're getting, whether it's how we approach bidding and the kind of dance we have. You know, the auditor wants us to have certain amounts, the bidders would like us to have another amounts, and of course, the bidders also struggle with bid bonds. So I'd really like to call your attention to that, make sure you understand what's going on there. As far as the gov deals go, online, you can find the vehicles that are for sale. I'm looking at them now, Joe, and they're talking like 17 hours. They're going to be expiring.
Yeah, the auction goes till tomorrow morning. We have 11 vehicles and one roller. We're at about $17,000 for all of them right now, and should go up above 20 by the time we're done. So we'll have those numbers for you before next week.
Some pickup trucks, Crown Vics, some smaller cars, Ford Focus. So yeah, check them out. We're getting to the point where you can look at, these are good prices right now, but always at the last minute when it comes to bidding, they'll go up.
They probably have a heart attack.
Very good. Any questions or comments, council?
Where can these vehicles be viewed?
At the Public Works Building?
Public Works Building over on Star Drive?
Correct.
Yes.
Okay.
If you go in, you go past the stone bins, you'll see a hole on them.
And so they're before the gate. They're not, the public could see them. They don't have to get beyond the gate. They're before the gate.
No, the public can see them.
Yeah.
Okay.
Okay. Any other questions, council? Hearing none. Moving through the agenda. Items 7 and 8 revolve around what we just discussed with both conditional use hearings. That is 25-1-C, Love and Bright Beginnings. That is the daycare center we discussed and that was presented this evening. And then also number 8, 25-2-C, Pyramid Healthcare Incorporated, and that was the one that was just discussed at length, and the and those will both be considered next Tuesday. The motions for next week, we have 6. Mr. Graziani, please.
Yeah, these are the white section as noted in your binder, so they're just behind the section that was noted, the orange section. So the first 2 deal with disposition for the Tricog Land Bank, and they seek our permission to do those as noted on Willow Drive and on Patton Street. The next motion deals with really emergency service. We use the word fire service, but it does involve EMS. And we're looking, we've been working together, myself, Mrs. Lang, with Mr. Poach and Mr. Hizzy on what kind of data as it relates to the fleet, what kind of data relates to call and response and performance, and trying to understand, the moving parts within emergency services, specifically with the fire.
I'll
and
add to
ambulance.
it my report when I do that this evening. I have a quick summary of that to discuss the nature of the motion we talked about.
Yeah, in your packet, there was information related to the state's program. The challenge with the state, quite frankly, is availability. There's only one specialist in the western part of the state who does the ambulance and the fire side. So if we go with the state, they help us with the cost. If we go it alone, we bear the cost of looking at that. This is important because we have a 5-year agreement that's ending with the fire departments, and a big part of the next agreement will be related to capital as it relates to what you have in front of you, the 3-ring binder, which we'll touch a little bit on later. The next 3 resolutions or motions deal with something that has been on the addressed this evening, but you may have been familiar with, and that's to extend Orchard Lane. I really would like council to know that in their binder is about as complete report as we can provide, including some of the testimony you heard this evening. So if you flip through the pages, you'll see Linda Quinn's letter to Tim Little of 2022 and her attachments making her case for the extension. And then you'll see Mr. Jamie Story's analysis of the existing ordinance, which was referenced, the PennDOT liquid fuels distances that we get paid for liquid fuels. He also includes maps and references to the aforementioned fire hydrant I think we heard about this evening. And I would really appreciate if council not only took a look at the packet, but if they're interested, Mike or myself, or just on your own, we would love to take you down there and get you to see what is being discussed. But in essence, it's extending from 2,534 feet to 2,713 feet that road via that ordinance. So what we would be seeking next week is for you to motion to advertise for that ordinance. The next is related to an ordinance to restrict trucks on Jamison Lane. This is a thing the staff has been working on with the property owners who utilize the trucking services back there. This is a short distance of a residential street off of Monroeville Boulevard near Goodwill. The street is a local road, and to enforce restrictions, we would entertain you considering an ordinance to do that. And information in your packet is related to that as well. Lastly is the motion to advertise an ordinance to update the zoning ordinance. The zoning ordinance was adopted in August of 2023, and as you can expect, about a year in, you find housekeeping items that you need to address. Thankfully, we have a certified planner on staff. Mr. Wilden has been able to kind of work through those, and with Mr. Ratcher, and just kind of, as they've come on in front of him, we need to address some things. So he's put together a package for your review, but what we're asking you to do is give us permission to advertise the ordinance. And of course, according to Municipality's planning code, we'll have hearings and other kinds of things as required to amend the zoning ordinance. Any questions on the motion section of the agenda?
No, sir. And just to be clear, the last 3 that you did mention, council's not voting on those items as far as enacting any of those things. All they're doing is they're voting to advertise an ordinance. So anything that would be approved would be for the following month.
Correct.
Just a point of clarity there. Very good. Council, any other questions? Moving through our resolutions, the first one is a board and commission vacancy that we're trying to fill. And then we skip down to number 16. Mr. Graziani, please.
Yes, so handed out this evening was a list of roads to be paved for advertising, so we would look to authorize a resolution to advertise these roads. I will say, if approved, $2.5 million might be the largest we've ever expended on a road paving program in Monroeville, if not one of them.
Yeah, it's close.
So what Mr. Story and Mr. Hugus have put together is a very detailed list of the roads. We in Monroeville have a system, a methodical system of evaluating roads and trying to maintain a level of service on those roads that's acceptable. So you can see the estimates on the front cover behind the agenda, and then there's 11 by 17s in your packet that look like this. And again, this is what Mr. Hugus handed out, and they were laying on, on your packets. One thing you can see on the bottom of the first page, I believe, the number of miles that are being proposed to be paved in the program is 4.42 miles. Seal coat, 10.21 miles. Crack seal, 10.5 miles. And fog seal, 4.27. So 37.4 miles are being addressed at some level in this program. It's a very ambitious program. Any more comment, Mr. Hugus?
No, I just want to make sure everybody knew there was a front and back to the spreadsheet, so make sure you look at both of that. You know, one of the general questions that we get every year is cost per mile. You know, and again, this is estimated until we have a bid opening, but to mill and pave 1 mile road now is about $330,000. To chip seal 1 mile, it's about $70,000. So you're looking at, probably 1/5 of the cost to seal coat, which I know is not popular, but both are integrated with the system. There's fog seal, seal coat, and mill and pave for your review.
The winter has been challenging on us, and staff really burned the midnight oil.
Yeah, winter was not good to us this year. The freeze-thaw cycles, it damaged some roadway systems.
You might have an idea in December what you want to do, but until really last week, as you guys were doing the final analysis, really burned the midnight oil to get this list to you and put the work in. I can't say enough about how hard they do and what an effort they do. It's very good.
Only one thing I would probably mention to you is, if you look through here, the mill and pave, about $350,000 of that is at Community Park. So we always think about roads, and we have 110 miles of roads, but we got 34 parking lots, which equivalent to about a little over 6 miles of roads. So, we also got to account for that. $350,000 is a pretty big chunk of money, and that's not the entire community park, it's just a portion of it. The rest of it will have to be done next year.
The staff was out, at 5 o'clock this morning doing the parking lot here.
Yeah, they were crack sealing. 'Tis the season.
Yeah.
And then this list, you might have mentioned this, Mr. Grazia, is this on the municipal website? Is this available?
We can make it available to post.
It is not on the website, no. This is for council's review and approval. Once the resolution's approved, we'll go through and put the bid specifications together and then put it out for public bid, and it'll be in front of you in June.
But certainly, next week, we can just have it, these are the ones being bid on.
Correct.
Now, what would change is if prices are not what we
Yeah,
expect, we
I'd be
may
hesitant
pull
to
back
put anything
roads.
on the website yet, because once if there's any changes to it.
Okay.
Subject to price.
Yeah, I just want to, because, and you've mentioned it, is what sometimes will happen months later, after roads are already approved or changed or done, residents come up and they say, you didn't do this, or you did that, or why didn't you do this? You guys didn't talk about this at all. So I was just trying to, as far as just being fully transparent, as far as how residents can understand the whole process. But maybe what I'm hearing is after next week's meeting.
Yeah, once you
that'll all
pass the
be published.
resolution, then we could put it on the website.
Okay, very good.
It takes us some time once we get the resolutions. We have to go out, measure roads, core bore the roads, to put the bid specifications together, to put it out to a public bid.
Certainly. Yeah, once again, just trying to talk about it as much as we can and make sure the public is aware of the process. And this process starts,
Oh, it's
the end of last
been
year.
a process since January.
yeah, so it's a long process. We talk about it publicly. We talk about all these streets, but there'll be multiple steps here in this whole
Yes,
procedure.
right.
Very good. Council, any questions at this point about the program?
Again, feel free to call me if you've got any questions.
Yep, and we'll consider this next Tuesday.
Answer your phone.
Item number 17 is a resolution. It's a housekeeping. Annually, we exonerate the tax collector from those taxes in 2024 that they were unable to collect. This year, the amount is $223,043.98.
And we do mention this every time, so this isn't like the people are getting off the hook. It's just it leaves the tax office, and then we send them to delinquent tax collections.
Yeah, you'll notice on the report even today, there was amount collected for delinquent taxes besides those that are current. So this will fall into those categories, or into that category. Resolution items 18 through 21 are sewage planning modules. And you can see, they're all related to one area. I don't know if, Mr. Wilden, you have anything more to add other than straightforward?
It's the Penn Monroe shops. They had a planning module for the entire property. Since then, they've subdivided it into 4 separate lots. So each lot is required to have its own planning module. So along with the subdivision, this is just a subdivision of the planning module.
Any issue from your office?
No, it's the same amount of sewage. There's no increase. They're just dividing it 4 ways.
Okay.
And this is all the Aldi Plaza, is that?
Yeah, Aldi's Mission Barbecue, Taco Bell.
Very good. Item number 22.
It's an exciting one. This is an application for a grant of $500,000 from the Commonwealth Finance Authority to be used for stormwater rehabilitation. Of course, the municipality since 2019 has been collecting a stormwater utility. And what we're able to do with those revenues are leverage those utility fees for grants like this, making us very competitive to get these. And again, kudos to Mr. Story putting this together, getting us in a position. You'll see a resolution, but we went ahead and gave you the guidelines for the program so you have a little bit of understanding. I'm not sure myself because I'm kind of new to this one. Is there a particular area that we're looking to address? Or
No, we actually have a list of, so this is for pipelining.
Pipelining.
And we're putting a contract together as we speak, but this grant opportunity came up. And again, we're asking for $500,000. There's a 15% match, so it's what, $75,000. But that would come out of the CIP of the MS4 funds.
Right.
Good stuff.
Okay.
Behind that is a discussion, again, relating to the lease agreement with Garden City Swim and Tennis Club. This is a 1999 agreement that's in your packet, and council, we're asking that you give us permission to move forward to start to update this per who's responsible for what and how things should work going forward.
And it's actually Garden City Swim and Tennis Club. That's how it's
Go figure.
legally named. Interesting.
From the 50s.
Yeah, very good. Hey, council, any questions about the resolutions this evening? Hearing none, we're going to move to our reports of municipal staff. Mr. Ratcher.
Nothing to report, Mayor.
Thank you. Mr. Graziani, back
Just
to you.
quickly, you have the second draft related to the capital improvement program. Mrs. Lang, with the assistance of the department heads who've been putting together this and working a lot. The next section, which you'll get in May, will deal with the funding, and it's basically this. We're looking at $2 to $5 million annually to fund the program, and right now the asks are in the $8 million range to give you a framework of the work we got to do. There's a May draft, there's a June draft, and we want you to be so familiar with it that in August you have a confidence to vote on the program. What's most important is all of this is going to set the direction of what we're doing on the largest of the projects, which is the Public Works Complex. And to do that, we're going to have to consider, whether we want to go into debt and do bonds and all of that. So there's a lot of work going into this. Be patient. All of the need side, if you will, the demand side is on paper. Now we're going to work on the supply side, or what you consider the funding side. And I'll be really honest with you, we've only been able, or I can only see us doing $2 to $5 million each year. And the asks are in the 8 range or more. And that isn't including how we exactly do the campus. If we do funding for the campus and we do it as fully as we think we may need to do it, that could be on its own a $3.4 or $5 million annual bond payment. So there's a lot to be thinking about. It's 148 pages or so right now. So be glad we didn't give you 300 pages in 2 weeks to review. We're giving you months to get caught up, and the hard part is yet to come. That's what do we have money to pay for?
Very good. Anything else, Mr. Graziani?
No, thank you.
Ms. Lang, anything this evening?
Just want to let council know that if you do have any questions, reach out to Alex or I anytime, and we'll certainly make time to answer those for you.
Thank you. Ms. Rock? Or no, Mr. Hugus?
No, sir.
Are you sure?
Yes.
Okay.
Nothing.
Thank you.
Aye.
All right, reports of our council members. Mr. Hizzy?
I have none at this time. Oh, yes, I do.
Time's up. Your time's up.
Deepest sympathy to the Fulkerson family on the death of his mother-in-law, 107 years old.
107
God
years
bless
old.
him. So, my prayers are with the
Remarkable.
family. That's all I have.
Thank you. Mr. Poach?
Yes. Oh, I knew better. Pull the plug.
Reference to the resolution that's, and it asked about us doing some of the fire service studies and emergency medical stuff. It's not a study, it's really an analysis of stuff too. So Jared, go ahead and see what we come up with for the first slide. Okay, good, no, all right, so good. A lot of things you can get off of YouTube as well. All right, so what's the ask? This is the important part right now. What is it that we're asking to do? This is a project Joe and I have also been working on. We pulled Alex and MK into it too. So we want to be able to, when we're done for next week, we want to be able to direct the manager to coordinate with some of the potential vendors and people that we talked about. Again, you see one example in there from DCED, pardon me, data analysis, some of the existing resources and assets that the fire and EMS capabilities in Monroeville. Take a look at it. What are we doing? Who, what, when, where, and how? In particular, when we talk about why are we doing this piece of it? This is probably, from a timeliness standpoint, the analysis of the fleet, all right? Currently, in the agreement that we have today, okay, that's still in effect through the end of this year, there's 41 vehicles in that fleet that we look at. And as many of you have found out, and we talked about, and I believe I sent each of you it was a journal article in terms of what's been happening in the fire and emergency service vehicle business. It was a business article that talked about that it's essentially kind of like a couple of monopolies, and what is running the delivery time and fleet costs are really, really much larger than we've ever had before, okay, to do that. So we want to take a look at that and understand what we have, the status of the fleet that exists now, what's in place, how we can work on a better, more economical fleet replacement program that still works and provides our needs to do that. But this needed to be, as we talked about a couple of weeks ago when we were talking about, two meetings ago, we talked about including things in the capital budget. Now these are capital costs. Up until recently, most of the time, the purchase of the fire apparatus and equipment in place has been just something we wrote out of the operating budget. It's not going to be that anymore, okay? It's not going to be that anymore. We just need to have a little better program to understand how we're going to proceed with it, as well. Some of the equipment that's in place, and it's on there, it's analysis, what do we have, how does it work, what kind of condition it is, to be able to meet any of the increasing demands. That's the part I didn't put in here now. I don't want to kill you with these couple of statistics. We're only looking back a couple of years. But right now, the last 2 years from an EMS perspective, Monroeville-wide's been over 8,300 a year, and then also now last year, I believe, was 8,400. It may be backwards reversed. But we had averaged about 23, 24 calls a day for EMS service and about 3 on the fire service side of it to maybe 4. Well, it's getting worse right now. That's what has changed. January and February already, we're averaging between 28 and 30 EMS calls a day to use, and our fire call usage is up to about 3.5 to 4, not quite 4 just yet, if the numbers would stay consistent. So, as I like to use the analogy, the train's been coming down the track for a while. Many of you have heard some of this when we were at the ALOM conference. I added this as part of my presentation that time. And those of you that will be at ALOM on Saturday, 1 o'clock, we'll be discussing this more in depth with a panel that I put together from across the county, some of the county EMS chiefs as well as the chiefs as well. So we need to collect the data and use it to put in some performance measures of what we have in the next 5-year agreements, meaning you'll have X amount of this available, what does it cost, how do we have enough ambulances, do we have fire fire service response, how are we doing with that response, and have a regular updating of that information. And my discussions with the chiefs that in past is like, okay, guys, we'll get into it. You're going to help us continue to do the job. I hope that's the message. That's the message Alex has delivered them. He's still our direct contact with the Fire Chiefs Committee, is always to run through, as in the ordinance, through the manager's office, but we've been trying to coordinate that positive look forward as well. So when do we want to do this? And that's probably the important part. The fleet review should be the top of our list. If for some reason we don't get enough data analysis to help with the development of the agreement expires, the agreement exists right now, we'll just continue on until we sign it. We don't want to go too far past it, but the physics may not actually work at getting the information done. But the fleet assessment of what we have is probably a priority agenda item, so that we're ready in August when we talk about capital purchases. Because again, these things are not going to be in this budget, operating budget. They're going to be capital, large capital purchases. And some of it, we have to consider what we can and can't be able to do with that. Some of the additional components in this analysis is the response capabilities, who's responding, how we're doing that, when are our busy times, how often those resources are called upon, and have this is the interesting part, have our responses met the needs of the incidents that we have in place? Are we able to put enough apparatus, enough people, enough personnel to the things that we've been doing? So this is the kind of drill down analysis that takes a lot of time and should be neutral from the individuals that are here, okay? Can I look through them? Yes. Can I come up with it? Yes. But I guarantee you, I already have a predetermined bias in my mind based on our experience. It needs to be kind of the cold, hard facts put in front of us. Are we meeting the demands? Because if we don't, and as many of you have heard, this is one of those 3 or 4 clear things that by borough code, it's our responsibility. If a fire truck doesn't show up when it's supposed to, an ambulance doesn't show up, along with the police car, certain elements in the roads, it fits them as well, to do that. Those are those things that are required under the borough code that we provide and look forward to. It's us that are responsible for that problem, okay? This may be another reason to have a motion, because we're going to ask Alex to do something here, okay? We need the data analysis that's on here, and it didn't, when we transitioned here, this didn't come out as large. I hate to read the slide directly to you, but it's essentially we want to use this data analysis so that we can direct the manager to be able to start to conversations with our surrounding communities that are asking us for help. Mike, you've asked a number of times correctly. Bob, you've asked a number of times correctly. Hey guys, how come we're in XYZ community? What's been happening? We know from my conversations across Allegheny County, certainly on the EMS side, I think you may have heard this number, I've told you in the past too, but pre-COVID, there was close to 60 ambulance services in Allegheny County. We closed out this December of this past year with 31. Okay, it's gone down. Our call volume has gone up. Makes sense, isn't it? Who are they asking for help? Us. And you heard the chiefs this past year in their testimony and budget testimony. Maybe, Bob, you might have been asked as it was, how many times have we had to bring in a lot of help to do that? And the answer was, in the previous year, was no. Okay, we're doing okay. This is not a crisis. I want to make sure everybody understands it. That's what we're trying to head off and avoid and plan for the next 4 or 5 years. At that point, we need to then be able to direct the manager to be able to start those conversations with folks. Similar in the nature, as you know, we have Monroeville and the Borough of Pitcairn have an agreement towards offsetting some of the costs. Ideally, it's not a great fee. We probably do need to come up a little bit, to do that in this next year to provide that service. It was for insurance costs, our workers' compensation costs, and our usage costs of there. Pitcairn's a bad example because we completely surround it. It might as well almost be considered like we're going to our neighborhood. So just as a reminder, so everybody understands this, the fire department has been an asset, from a community asset in Monroeville, way longer than some of us probably realize, to do that. And April Fool's, you get some really ugly looking guys to come back in this particular photograph on here too, as well. But number one, if we think about it, this year, 3 of the fire companies are going to be 70 years old. They've been part of the community for 70 years, okay? Last year, correct me if I'm wrong, Joe, thank you, it's on here, coming through 75 years, okay, we've had that. But what else is going to be interesting is next year, as part of the community in 2026, they're going to, Company one's going to be around for 100 years. Do I have 2026 correct, Paul? I believe is the original start, not 27. Thank you. Thank you to do that. So these are assets that we have to look towards to see how do we nurture and continue moving forward. Will this always be the same configuration? I honestly don't know. I honestly don't know. Do I have a gut instinct on it? Yeah, maybe I do. Okay, but that's what I'm trying to avoid, is my inbred, bias towards trying to make everything happy all of the time. Economics are not doing that, and that isn't happening too. So, as well, Bill's looking, you just realized he's standing in the picture, right? Oh, the guy's making fun of everyone that's on there
I was
too.
laughing at the inbred comment.
Yeah. So, any questions, guys, right now that we can ask or what we're looking forward to?
What was you saying, how many calls per day?
Right now, from an EMS in February, we averaged 30 a day.
How many out of town?
Good question. I don't have a daily on that part. Last year, the current data that we listed, which may or may not have to go back through, it included some of Pitcairn because we did it by zip code, but
Beside Pitcairn, let me put it that way.
close to 1,000. Close to 1,000 calls outside of town.
Question, Eric.
Yeah.
You said 30 now. Does that, all the fires? All
For
the EMS?
30
or
per
is
day
that
was EMS,
full?
everything.
That's them all.
Everything
All
together.
nine.
So for the construction and for our purposes from the from a municipal standpoint, we regard, based upon the agreement that we put together, our agreement is with all of those companies together. Okay, always remember that that is what our agreement is. In a way, this is sometimes a little upsetting, but I do use this statement, in a way, we arrange a contract with them to provide that service that we're responsible for, to do that.
And basically, out of those 30 calls, we still have 4 ambulances in Monroeville at all times? Yes or no?
That's the goal, Bob. Good question. I don't have a solid statistical answer to tell you. That is the goal, when you talk to the chiefs to do that. I wanted to see how often, through this analysis, we're able to continue to meet that goal. I would tell you, because we're answering the calls and not having other people come in, the answer is yes, we're meeting that piece of it. But let me tell you something, and this is an interesting challenge, and this is for me talking to the chiefs. Everybody is struggling to get people and personnel. It's so much so that they've had to add full-time. I could not believe from when we started the ambulance service separately in the early 1980s to have career personnel on, say, here's another entity that's in there, which is now grown. So the fire companies band together and run their career personnel through the same payroll system, and it's done in place one group. There's 25 full-time career employees, okay? Almost half of the number of, almost the police department size of that too. Certainly not at the same salary range, with making up the difference of that of close to, and I double-checked this last night with someone that was doing the payroll, there's still close to 100 people that are listed as part-time employees to help make that, to meet the goal that you're doing. So I want a hard answer to understand that.
Well, is that a goal, or was that part of the agreement? That
It
there
was not part of the,
four here?
it was not part of the
It wasn't
last
part of the
agreement. It was not, okay, to do that.
to see
It's to
that.
provide the service, but to see, exactly, can we do that? But remember, guys, and this is extremely important, if we ask that to be a goal, what are we doing? We're signing on to help them meet that goal, okay, to do that in a
Well,
number
we've
of different
signed on
ways.
already to pay for the fuel, for the tires, for
Yep.
the maintenance
Yep.
of every EMS vehicle.
And not only that, the thing that worries me the worst, as you've probably heard me say, is the risk and liability that's added to it. Our numbers have gone off the side, Joe. We had this, I queried Joe and said, how's that been this past year for insurance to do that? And our workers' comp is one piece, which we know why, that wasn't necessarily fire-related, but it's going to be high, and we are going to own that for 5 years, okay? To the point we have serious conversation if we have to consider, not WISC,
Property.
thank you, yeah, to add to a different insurance piece. I don't think we'll have to, but that's a real problem, our liability. And remember, and you guys will hear this Saturday if you make it to that presentation, because of the way the legislation has moved, we have moved into a section, in the way at post-COVID, we're healthcare providers. The municipality we're required to provide EMS, arrange EMS. Now, when I say required, that doesn't mean we have to, have full-time employees. We have to make an arrangement for emergency medical services, in an agreement. But guess what? without that piece, healthcare gets worse now too. So they're throwing that piece onto us as the baseline. There's a National Institute of Health argument, I'm glad, happy to share with you, the study post-COVID. They put what a great burden things would be worse if there wasn't EMS. And Bob, we had a conversation the other day, a time you had to spend in the ER because you're kind of bad, you were hurting, but you weren't in bad shape. You're here with us, thankfully, to do all that. But where were you down on the list? Quite lower, because there were a lot of sick people.
80 people for 32 beds.
Yeah, ahead of time. And if EMS wasn't involved with it, the problem would be worse. So this is what that study is. So I want to be ahead of the problem and against it, to do that.
Answer me this.
Yeah, but
How many ambulance companies went out of business and expect us to cover their area?
It's a good question from it. It's not really necessary who just went out of business. Think of it as dominoes. That's what usually happens. It has become as extreme that because of these effects and lesser resources of people covering those communities, and that's the reason I'm using this year in my presidency at ALOM or whatever to point to everybody, guys, you have to get in and roger up in your own fair share. We're going to have some examples of that on Saturday of how different people, can do that. So it's like a domino effect, in that short a period of time, it's unbelievable.
Can I say something?
Yeah, Bob.
I just want to say, I had the privilege of
Your house
having
being on fire, yes.
the ambulance picked me up about a month and a half ago.
Mhm.
They took me to the hospital. They were fantastic.
Absolutely.
They were just great.
And, I can't, and I don't make as often appearance, thank you for the comment too, and I know the fellows I'll pass that along to them, okay, to do it, because I know where you live, to do that too. But one of the interesting things that has happened with these employees, you can think of us as our guys have been moving on to a lot of different places. As you heard, there's a fire rescue expo here, 3 weeks ago now, was the last time, Joe? And we were there, the District of Columbia Fire Department was sitting here recruiting. And one of the guys turned to us and said, they're all from Pennsylvania, they're here too, said, oh yeah, we have our 18th person starting from Monroeville on Monday. People that have participated in our fire stations, our programs, our training, our resources, there's 18 of them that are now on the job in the District of Columbia Fire Department to do that. And they go, oh, you're from where? And literally they go, oh, they know they come down trained, they come down with this, they come down with that, they come down prepared, and they turn out to be good employees. It's a huge number of them, larger than we've ever had before, to do that. So hope to see everyone then, ALOM on Saturday, 1 o'clock, okay? We'll dig into this. It's a decent presentation, I can assure you. From that, I saw it today. We worked on it with the group that I have that we're moderating to do that, and we're prepared because we have I've had a lot of questions from ALOM to be able to move forward. So thank you guys. See you guys on Saturday with it. Thanks.
Thank you, Mr. Poach. Mr. Stevenson.
I'll be brief compared to
I said that too.
someone else.
Everybody. We're used to that.
I would just like to give kudos to everybody that lives in Monroeville and drives on our roads. We just went through terrible traffic on Route 22 for a long period of time, and our citizenship did a great job. There were very few problems throughout that whole period, and I give kudos to them. Unfortunately, we're now seeing problems on the Parkway and the bridges, and I'm just asking you to try to be as patient as you were 6 to 8 months to a year ago, and just try to get through this as smoothly as possible. Let people in, let people out, do the best you can, and prevent any road rage from happening. And that's all I have.
Thank you, Mr. Stevenson. Mr. Crichton.
Nothing, thank you.
Mr. Adams.
Nothing tonight, Mayor.
Mr. Williams.
I just want to give my condolences to Pat Fulkerson and his wife Fran on the loss of Fran's mother, Frida, who was 107 years old. I worked with Frida's husband for many years as a structural iron worker out of Local 3, and the whole family's great people, and may God comfort them in the days to come. The other thing is, you just heard a from Mr. Poach's report on the EMS and firemen. They're in their fundraising season. They are in need of your support, as they are mostly volunteers. They do a great job. In my report last month, I told you I went to the hospital, and the EMS people come. The men and women do a great job. My wife was taking garbage out to the curb, and they said, no, we'll do that. So they took the bag and took it out to the curb. The garbage wasn't me. It was real garbage.
Although we would have picked it up. We picked it up.
We picked up everything.
Yeah, but anyhow, that was great, and they did a good job. Please make your donations to your local fire departments, and if you don't know who they are, send it to the municipality, and we'll make sure it gets to the fire department of your choice. But the volunteers do a great job, and they need your support. We hate to raise taxes, and this is one way to stop that, by supporting your firemen and your EMS. Another thing is,
Thank you. Appreciate it.
Bring us the mic.
we got a big packet, and I would say for council to bring your packet next Tuesday and tell the manager, don't reprint it. That's a lot of resources right there, so, and I know I mention that often, and I'm not a tree hugger.
Yeah, sure.
It's just a waste of resources and paper, so anyhow, that's my report, thank you.
Good suggestion. Thank you. Mr. Biondo.
Dr. Becky does that every month. I can back him up on that, so.
It's not just because you're here.
Not just because you're here.
You really liked him last month. He was all green.
Just kind of to piggyback off what Mr. Stevenson said, Old William Penn is under construction. It's not going to be closed throughout the summer. Entirely throughout the summer. There will be closures regularly. If you are detoured up through Garden City, please go slow. There are homes on that street. There are children that live in that area. Please be careful on the roads. And with that, and condolences to the Fulkerson family. And that's all I have.
Thank you, and I will as well echo the condolences for the Fulkerson family. And with that, I would like to seek a motion to adjourn.
Motion to adjourn.
Second.
There's a motion second. All in favor?
Aye.
Opposed? This meeting is adjourned. Thank you and good night.